Hope you're all doing well in these times of craziness. I've been asked by a lot of students, colleagues, people in the industry and others what my perspective on this whole thing is, and whether perhaps we're playing into fear-mongering or whether it's maybe even more serious than we think. And I think the answer to those questions is very complex. And, although I've been involved loosely in public health and epidemiology through my research work, which had implications for public health, I'm certainly not a public health physician or an epidemiologist, and certainly not an immunologist or virologist. But there are some interesting aspects of this as it pertains to health and to life in general. And I think the most important thing that we need to recognize is that we're not going to benefit from panic, and particularly panic buying. We're not going to benefit from an overt state of fear, but we need to be prudent, because the real implications of this are going to be social, they're going to be economic, and they could potentially be quite devastating if we don't manage to flatten the curve. Now, a lot of people will say, well, it's not as serious as another illness. Maybe it's not transmitted as easily as another illness. Maybe it's not as fatal as another illness. But those are not so important when we look at the implications. This is a new thing. That's why it's dangerous, because it's new, it's novel. It's not the same as the seasonal flu, which we have means to combat and we're used to combating every year, or other illnesses. It's something that's new, so it's on top of that. There's an additive effect there which could have a real burden on the health system. It also is transmitted very freely, and it seems to be a very infectious virus. It's transmitted very easily between people, and it does appear at this stage to still be more fatal, more severe, particularly for the most at-risk people, than, say, well, certainly more than a common cold, but also more perhaps than influenza. And so we need to consider that, because although it may not affect young, healthy, fit people all that seriously, that's not the danger. The danger is that young, fit, healthy people can transmit this to maybe immunocompromised people or to older people who don't have the same resilience and for whom the mortality rates seem to be very high. Now, even if people don't die from an illness, if it's severe enough, because maybe they're in one of those subgroups that is more affected, then they'll need to go to hospital, and it creates a burden on the hospital system. If we get to a point where there are too many people entering the hospital system at one time, like as we saw in Italy and Spain, then it means hard decisions need to be made as to who's treated. And those are the types of decisions we don't need to face if we can flatten the curve, and we really don't want to have to make those decisions. We want to be able to look after everyone to our best ability, understanding that we're probably not going to stop this illness, but we can certainly slow the spread, deal with it, and have the absolute least effect, both for health now, the health system overall, society, and the economy. And obviously the economic implications are huge, because at the moment a lot of people can't work, they can't go into work. There's a lot of distancing, in terms of reducing travel and all sorts of things that are going to have drastic effects on the economy. So there are also people being affected in terms of their health, their wellness, their lifestyle, because of those economic implications. So we really need to be prudent about what we're doing here. I'll put in the show notes or in the links on any post that I put out using this vid, some of the links to the World Health Organization, the Centers for Disease Control, the Ministry of Health, that have really good guidelines as to how we can slow the transmission and deal with this illness. But some of those things that we want to do are to make sure we wash our hands, wash them for at least 20 seconds, wash them well, and to do that at those most important times particularly, like before we eat, after we've touched somebody, and after we've used the bathroom. These are simple hygiene things, and maybe that's going to be a good long-term outcome from this as people get back on track with just some good hygiene practices. We also want to avoid any unnecessary contact with people, and that sort of has a macro and a micro scale. On the macro scale, it may mean things like just not going out if you don't have to, not attending events if you don't have to, maybe not going into work if you can work remotely, things like that. On the more micro scale, that involves just keeping a little bit more distance between yourself and someone else. So maybe not shaking hands, maybe not hugging or kissing someone when you see them, keeping maybe a meter or more distance between you wherever possible. So there is a lesser chance that body fluids, particularly sputum, can be transmitted between different people. The take-home message that I think is really good, which I've heard, is that you want to basically act as if you have the virus. But you may actually have it, and you may have it and not be showing any symptoms, in which case you're a danger to people who are more at risk. So if we all act as if we have the virus, then it's far less likely that it's going to have those runaway rampant transmission rates, which are really the biggest problem. But there are some other things that we can potentially do to stay healthy during this time as well. And I think, unfortunately, there's been a bit of a move to sort of derail any efforts for people just to be healthier. Because let's face it, there have been a lot of people trying to profit from this, maybe trying to sell various supplements or touting, cures for this virus. I'll say straight up, there are no cures for this virus at this stage, although people are working on it. And there are certainly no diets or supplements or exercises that people can do that are going to either prevent them getting the virus or that are going to stop the virus, because there simply haven't been the studies done yet. There are some things that will help other similar viruses like colds and flu-like viruses, but they haven't been tested necessarily for COVID itself yet. But maybe those can give us some indications of things that might help us just to be healthier overall, but we certainly don't want to put all of our stock in those things or not do the things we know to stop transmission or that will impede transmission, the measures I mentioned before. One of the things that we need to be aware of, though, is that the approaches to the illness now are going to have health effects as well. What I mean by that is that social distancing in particular can have potential negative effects on mental health. If we're not being around people, if we're not having the contact we're used to, then that can be very isolating. We're going to be isolated because a lot of people are self-isolating, and that has quite large effects on our mental health, encouraging increased anxiety and depression. So we need to be aware of those things, and we need to work with that to make sure that we are staying in contact with people, maybe giving them a call, maybe jumping on some online discussions with people, and maybe using, social media appropriately. But we also need to recognize within that there are some positive and some negative effects from social media. We know from the research that people will benefit from social media because it gives them support and community. But where people use social media excessively, overuse social media, and particularly where that use of social media, and actually other screen devices, but particularly that use of social media where that drives poor sleep, then there are a number of negative health effects from that as well. So there could be some opportunities within this as well. We don't necessarily want to, play this up as a positive thing, but there can always be opportunities and positive outcomes from any adversity. Some of those for maybe the mind and spirit could be that we use this as an opportunity to learn. I know a lot of my students at the Holistic Performance Institute are using this as an opportunity to really get into their course material. They might be at home a lot more, and it's a really good chance for them to learn and grow and expand as a student or as a practitioner. So you might take this opportunity to get online and learn something. I know a number of people as well who are using this as an opportunity to get back into a habit or get into a habit of mindfulness. They're using this because they're going to have more time maybe alone, more time at home. They're using this as an opportunity to maybe kickstart a meditation habit, or maybe get back into yoga or start yoga or Tai Chi. Do some things that will really help in the long term with their mental and spiritual, psycho-emotional health. It's a really good chance to create those better habits of health. and to maybe reevaluate some of the habits we have that are possibly not so healthy. Maybe we start to reevaluate our social media use. Maybe we start to reevaluate how much sleep we're actually getting. And we can start to change those things, because it's almost like a retreat in which we don't have the same imperatives to go out, because they're simply not there. So there can be some positives that can come out of this for the mind, psychosocial health, psycho-emotional health. And similarly for the body, we do need to remember that, like I mentioned before, the proviso is always that we don't want to think of things that we're doing for the body as being, cures. What we really want to look for is that we can become healthier. If we're healthier, it's more likely that we're more resilient in the face of any adversity, whether it is having to run away from a tiger or a bear, or whether it's that we will be healthier, which we know has benefits to fighting off various pathogens, whether they be viruses, bacteria, protozoa, whatever. The healthier we are, the more resilient we are. It doesn't mean we're not going to catch something, so we still need to be prudent. It doesn't mean that we can't transmit things, so we still need to be prudent. But we can also help to lessen the spread if we're doing those prudent things, like staying away from people, washing our hands, all those various good interventions, and also being healthy ourselves. So there are obviously things that play into health from that physiological foundation, and nutrition is key for that. There is a large body of evidence showing that when we eat a diet that is just overall of a better quality, by that I mean focused on unrefined foods that are nutrient dense, so that we're nutrient replete. In other words, we get all the various macro and micronutrients we need from food. We will probably have better outcomes over the long term for health and for mortality. That includes being a little bit more resilient in the face of these types of infections. So really that's the basics. We don't want to get too down into the weeds on this, because if you're not taking care of the foundations first, all the other stuff doesn't really matter anyway. So it's about having meals that are based on a good quality protein, that have lots of vegetables, let's say, 3 fist-sized servings of veggies or so, good healthy fats, and then carbohydrates from whole, unrefined sources that is appropriate to your level of carbohydrate tolerance, your activity levels, and maybe just what you benefit most from in terms of being able to stick to healthy habits of eating. So you just want to take care of the basics and make sure you're eating a good nutrient-dense diet that's based on whole, unrefined foods. To keep moving is really important, and again, I know that some people are also using this as an opportunity to get into better habits of movement. Even though they might be stuck at home, you can still do calisthenics, so you can have if you have weights at home, you can do your training at home. You can do body weight stuff, you can do yoga. There's lots of things that can be done, and this can again be an opportunity to get into healthy habits of movement. Now we know that movement, being active, being mobile, having good cardiovascular fitness, improving your strength and power, all those various facets of fitness have implications for long-term health as well. And again, that can include being able to better modulate our immune functions. Similarly, supplements can also help in some cases, but we don't want to approach them with the idea that we can take supplement X and that's going to stop us from getting COVID, because we just don't know if that's the case, and it's probably, in all honesty, not the case. But there are certain things that have been shown to help other viral infections that might be quite similar, like having enough vitamin C. And I don't necessarily think we need to jump the shark and start taking mega doses, but getting enough vitamin C in our diet, which we would probably get, to be honest, from a good natural unrefined diet and maybe a good quality multi-nutrient, sort of a whole food based multi-nutrient. Making sure we're replete in all the nutrients is obviously important, but others like vitamin A, zinc, vitamin D are also very important. And given that we're going into autumn, starting to move into winter here in New Zealand, there can be some benefit probably from taking a vitamin D supplement. Again, you could probably get all those things, vitamin A, C, D, zinc, from a good quality multi-nutrient. On top of that, there might be some other things that can help with immune support. Some of the mushrooms are being implicated for that now, and you guys know that I like mushrooms. I think they're a really interesting area of research. But again, there's nothing that has been definitively shown there. But in terms of general health and supporting your general health, they are supplements that maybe could be included within that. Not treating COVID, providing for the base of health that might help you to be more resilient irrespective of what's going on. So I was asked to outline what I do, and to be honest, I'm not doing anything specific during this time because I don't think that's appropriate. What I think is appropriate is to refocus on the habits of health. So I'm focusing on my training, and I do that at the moment. I'm not doing so much jiu-jitsu because we're practicing a bit more isolation, so I would usually be doing that about 3 or 4 times a week. At the moment, that's nothing, but it might go back to once or twice a week as things start to move on. But what it means for me at the moment is to alternate a day of strength training with a day of yoga. I also try and get out and go for a walk outside every day, away from the busy areas, so I'm not really in contact with a lot of people, but that's also an opportunity to get out and spend some time with my partner and with my dog outside in nature. And so covering off those movement bases. Nutrition-wise, I've actually upped what I'm eating a little bit at the moment because I'm actually training quite a lot, and for some reason I just felt like I needed some extra energy. Now, I don't know why that is exactly, but what that means is I'm not fasting through the morning like I used to do, or that I have done at times, particularly when I'm trying to lean up. So I'm starting the day with a nutrient-dense shake in which I have some pea protein, a multi-nutrient, good green stuff, some cod liver oil, which I'm using at the moment instead of fish oil because it has additional vitamin A and vitamin D in it. I'm just going to use that until the bottle runs out, so that'll probably be a couple of weeks. And also adding just a variety of different mushrooms from a liquid extract to that shake in the morning. Now that could be shiitake, reishi, lion's mane, cordyceps, depending on how I feel. I'll use cordyceps if I want to have a good train. I might use lion's mane if I want an extra boost for the brain. And I'll alternate between shiitake and reishi just for general health benefits. But again, none of it's to treat COVID. It's just to preserve and amplify health, because I think that there are some really good evidence-backed benefits from these various things I'm taking. Then obviously lunch and dinner, standard stuff, based on protein. So meat, 3 fist-sized servings of vegetables, 1 to 2 thumb-size portions of healthy fats. And then because we're training hard at the moment, we might also add some carbohydrate to that in the form of maybe some whole grains, typically gluten-free grains because I have Crohn's disease, or maybe some kumara, a little bit of potato, something like that. Not always with the carbs, but depending on how we feel based on how active we've been. And really outside of that, just trying to keep in good habits of health with turning off screen devices maybe an hour or 2 before bed, getting to bed relatively early, around sort of 9 p.m, and then waking up nice and early as well and getting into the day, feeling productive, and taking the opportunity to do a lot of work on things that we can do from home. We work from home anyway, but it also means for me, work-wise, I've had all my speaking gigs cancelled for the year, which has resulted in a significant loss of income for us. But we're trying to pivot and just use this as an opportunity to shore up other things in the business, to create new course material for the Holistic Performance Institute, to maybe get in and write a new book or revise some of my old books. There are lots of opportunities there. I understand a lot of people won't have those same opportunities, but we all need to try and be as positive as we can, do what we can to get through this and come out the end in a better position. And in doing so, also be aware that we can help to support others who are maybe not so fortunate with respect to their health or with respect to where they're at financially or where they are in their economic system, because there are people who are going to be very affected by this. So check out the show notes for this. They'll be up at my website, cliffharvey.com. Find this article, There'll be a bunch of links in there to other really good resources, some of the things that I've mentioned within this. And if you do have any questions at all, just hit me back, let me know. I'm happy to jump online and do workshops or Q&As, whatever it is, to help people out during this time.